Okay, we still have a couple people entering. All right, good. All right, welcome everybody.
Hi.
Hi. So welcome to the 2022 Virtual Benefit Fair. My name is Liz Gamble. I'll be your host, and my co-host is my colleague, Tracy Lavoie. She's our payroll benefit specialist in the Human Resource Department. We are going to be recording all of our sessions today, so those who can't make it have an opportunity to review these at a later time. And each presenter that we're going to have today will do a brief presentation on the many benefits and service offerings, about 25-minute session, and then we'll open it up to a Q&A. So we're going to kick it off with Diana Hernandez from Harvard Pilgrim Healthcare, who's been a longstanding vendor for the town. So I'm going to hand it over to you, Diana.
Thank you. Thank you very much, Liz. Hello, everyone. I'm happy to be here with you all today. I'm going to share my screen so that you can see the presentation for today. Let's see here. And Liz, if it's okay with you, give me a heads up when you can see my screen.
Okie doke.
So it says host has disabled from screen sharing. Okay, so it's not allowing me to share the presentation.
Okay, let's see. Try it now.
Okay. Awesome.
Little
That worked.
snafu. Okay, great.
Okay.
Perfect.
Perfect. Can you see my
Okay, yes, I can. You are good.
Awesome. Start from beginning. So let's jump right in. And you can see my screen, correct?
Yes.
Awesome. So let's jump right in. So I want to talk about the combination. It's something that has been out in the media. Harvard Program and Tufts Health Plan are now one combined organization. And as a member, there's nothing that you need to do differently. Your benefits that you still enjoy today, the programs, the tools and resources will remain the same and will remain in place. Harvard Program and Tufts Health Plan united to improve affordability, also increase access and improve quality of health as well and streamline member experience. So it's very important for us as members to understand if there's any changes or anything like that. And there's no projected changes on the programs and benefits you enjoy today. You can continue using your same ID cards, logging into your secure online account via harvardprogram.org. So Harvard Program continues to support its members through the COVID-19 pandemic, offering free virtual well-being classes through our Live Well at Home virtual classes. We offer guided mindfulness sessions, as well as health and well-being webinars, yoga and Zumba classes as well. And for additional support, we have our clinical care team and also behavioral health resources available. For more information, please visit harvardprogram.org/coronavirus. And these classes are sporadic as well. Some of them happen in the morning, afternoon, and like after evening sessions. And it's just to capture everyone, especially for those that would like to do these sessions at home with their families. So definitely log in and take a look, just because there's different timings for the mindfulness sessions, the well-being webinars, and the yoga and Zumba classes. Those happens on Thursdays and Tuesdays as well. But for more information, definitely visit harvardprogram.org/coronavirus for more information on those classes. So we're going to review the network now. So within the Harvard Program Network, we're contracted with 85,000 doctors and clinicians and over 182 hospitals across the Harvard Program Network. And that's within Maine, New Hampshire, Connecticut, Vermont, New York, Massachusetts. I mentioned Massachusetts, Rhode Island, and Connecticut as well. So this is the Harvard Program Network. Outside of this would be considered out of network. So it's important that with an HMO plan, you remain in network and you select a primary care provider from the Harvard Program Network, and referrals are required to see specialists. I do want to mention that with this account, you have emergencies and unforeseen sicknesses covered via the plan. That's if you're traveling to a different state, if you're traveling abroad, you definitely have coverage for emergencies and unforeseen sicknesses under this plan. As this is a growing area of concern, Harvard program ensures that our members have a broad regional and national network of high quality behavioral health providers within our network and also outside of network, out of network as well, just because we also offer virtual visits through our partnership. And I will also talk about that in a few further slides about Doctor on Demand. So it's very important that our members understand that you have the option of seeing behavioral health providers virtually via phone or tablet or mobile device computer. And so that is, we offer these services to our members to offer also flexibility, and we understand that this is a growing area of concern as well. We have a member-focused behavioral health webpage. If you're behind your Harvard program login, you're going to just click Member Dashboard, and under Member Dashboard, you will select behavioral health care. If you're on the public landing page, you simply go to harvardprogram.org/public/behavioral health care just to go to our dedicated behavioral health page. So today we're going to be discussing the traditional HMO plan, the Rate Saver HMO, the benchmark plan, also the HSA qualified HMO, and also discussing other programs like the telemedicine services, over-the-counter prescriptions. We're also going to be discussing the $300 fitness benefit, weight loss reimbursement, and also our well-being platform. So this is a high-level overview comparison across the four plans. The first plan that we see here is the HMO. We call it traditional. So this plan does not have a plan year deductible. It does have an out-of-pocket maximum. Your medical out-of-pocket maximum is $2,000 per individual, $4,000 per family, and your prescription out-of-pocket maximum, or what you pay in a given year, for medical expenses and prescriptions. So for prescription is $3,000 per individual, $6,000 per family. Preventive care is covered 100%. Your PCP visits and specialist visits are subject to $15 copay, so as well as your routine eye exam. Your emergency room visits are subject to $75 copay. If admitted, the copay is waived. Acupuncture and chiropractic services are subject to $15 copay, 12 visits per plan year. Physical and occupational therapy services are subject to $15 copay, and it's 60 visits per plan year. So things like inpatient hospitalization, outpatient or day surgery, diagnostic labs and x-rays, and advanced radiology, things like MRIs, CT scans, are all covered in full. And then the prescription drug plan for this plan in particular is a 3-tier plan. The first prescription that fall in the first tier are subject to $10 copay. Prescriptions in the second tier are subject to $20 copay, and prescriptions in the third tier are subject to a $35 copay. And then members also have the option of doing mail order for any maintenance medication. So tier 1 is subject to $20 copay. Tier 2 is subject to $40 copay. And then tier 3 is subject to $105 copay. So this is the traditional HMO plan. The Rate Saver plan does not have a deductible associated. The plan year out-of-pocket maximum is $2,000 per individual, $4,000 for family. And then the prescription out-of-pocket maximum is $3,000 per individual, $6,000 per family. And then preventive care is covered 100%. That is across all four plans. And that's part of the Affordable Care Act, that preventive care is covered 100%. Office visits and PCP visits and specialist visits are subject to $20 and $35 copay. Your routine eye exam is subject to $20 copay. Emergency room visits are subject to $100 copay and is waived if you're admitted. Acupuncture and chiropractic visits are subject to $20 copay, and it's 12 visits per plan year for each of the services. Physical and occupational therapy is subject to $20 copay, and it's 60 visits per plan year. Inpatient hospitalization is subject to $250 copay. Outpatient or day surgery is subject to $150 copay. Diagnostic labs and x-rays are covered in full. And then things like advanced radiology are subject to a $100 copay. The prescription drug plan is a 3-tier prescription drug plan, and tier 1 is subject to $10 copay. Tier 2 is subject to a $25 copay. Tier 3 is subject to $45 copay. And you also have the option of doing mail order for any maintenance medication. Tier 1 is subject to $20 copay. Tier 2 is $50 copay. And then tier 3 is $90 copay. So moving on to the HMO benchmark plan, this plan has a deductible. The annual deductible for an individual is $300 and $900 for a family. The out-of-pocket maximum for an individual for medical services is $2,000. And then for a family is $4,000. For prescription drugs, the out-of-pocket maximum is $3,000 and $6,000 per family member. Routine preventive care is covered 100%. In your office, PCP visits and specialist visits are $20 and $60 copay. Your routine eye exam is covered in full, and it's one visit every 24 months. Emergency room visits are subject to your deductible, and then once deductible has been met for the year, whether you're an individual on the plan or a family, it will be a $100 copay. Acupuncture and chiropractic services are subject to $20 copay, 12 visits for acupuncture services per plan year, and 20 visits for chiropractic services per plan year. Physical and occupational therapy services are subject to $20 copay, 60 visits per plan year. Inpatient hospitalization, it is tiered, and depending on the tiering of the hospital that you go to, tier one hospitals are subject to your deductible, then $500 copay. Tier 2 hospitals are subject to your deductible first, then $500 copay once deductible is met. Tier 3 hospitals are subject to your deductible first, and then $1,500 copay once deductible has been met for the year. Outpatient or day surgery, also subject to your deductible, then $150 copay. Diagnostic labs and x-rays are subject to your deductible, then covered in full. Your advanced radiology services are subject to your deductible, then $100 copay. And then your prescription drug plan is a 3-tier. Tier 1 is subject to $10 copay. Tier 2 subject to $30 copay. Tier 3 subject to $60 copay. And then also doing maintenance medications, you can do mail order for any maintenance medication as well. Tier 1 is $25 copay. Tier 2 is $75 copay. And then tier 3 is $165 copay. And then your HSA qualified HMO plan, it is a high deductible health plan. So that means that all the services will go towards the deductible first, and then you have some cost share. With this plan, the annual deductible for an individual is $2,000, and for a family is $4,000. And the out-of-pocket maximum, or what you pay in a given year for medical expenses, is $5,000 per individual, $10,000 per family. This plan also has a 3-tier mail prescription order, prescription plan, and it is subject to your deductible first, so keeping that in mind. So we will now be going over how to confirm your primary care providers online. Simply go to harvardprogram.org, and when selecting Find a Provider, you're going to select HMO or HMO Open Access to search providers. So as I mentioned earlier, prescription for over-the-counter prescriptions are covered at a tier 1. Simply ask for your doctor to write a prescription. The doctor can write a prescription for up to 90 days, for a maximum of 90 days for any over-the-counter medications. So for things like coughs and colds, allergies, dermatology, and gastrointestinal medications, over-the-counter prescription, definitely use your best judgment, just because if the tier 1 cost share or copay is a little bit higher than what it would cost buying it from directly from the pharmacy, use your best judgment in that case, just because sometimes it can go either way. So to look up prescriptions is a premium tier 3. You're simply going into the harvardprogram.org/RX if you're going through the public plan, through the public site. If you're logged in, if you're behind your login, this will already be populated. Simply go to RX, and then your plan will already be auto-populated, and you can search up the prescription. Members have access to their digital ID cards available online. It is portable. You can download it from the mobile app or directly from harvardprogram.org. Apple users can save it to their Apple Wallet, and Android users can save a PDF copy. The ID cards are dynamic and update in real time as well. When you're logging into your Harvard Program Online account, you have access to your benefits, claims history, also deductible statuses, out-of-pocket maximum as well. So I encourage you all, if you haven't already, to create your Harvard Program Online account, just because it has a lot of great information. It's super, has a lot of tools and resources available to you. This here is our transparency tool. It's estimate my cost. So if you have any questions, or if you're going in for medical treatment and you'd like to see what your out-of-pocket cost and estimate, you can certainly go in. The more information you enter, the more accurate it will be, the estimate. Your activity summary is very important. It gets posted to your Harvard Program Online account monthly. And when you go in for services that are subject to your deductible or have co-insurance, you receive a copy in the mail. So your activity summary spells out what the medical claim that we received, what was covered, and then what needs to be covered by the member. So understanding your urgent care options when your primary care provider is not available. You will have telemedicine services covered on the plan. That will be the least out-of-pocket cost. Convenience care clinic would be the second lowest for services. Urgent care clinics are also available, and you definitely have coverage. They have the extended hours, also weekends available. So standalone urgent care facilities are always a great resource, especially when it's not an emergency, but more urgent. And then the emergency room will definitely be the highest out-of-pocket cost when it comes to urgent care situations. Members also have, through our online account, members also have the ability to gain access to our online portal. It's our well-being platform that is designed to accrue points, and through accruing points, you get Amazon gift cards. I would encourage you all to go into Harvard Program Online, and you can access the well-being portal by simply going to tools and resources at the top when you click on member dashboard. There are definitely a lot of discounts and savings online. The first one, the most popular one I would say, is the fitness reimbursement of $300. We also offer different discounts for eyewear through our iMed network, as well as all members have access to free health coaching. But there's definitely more information online. Go into your Harvard Program Online account and go into discounts and savings, just so that you can see the wonderful discounts and savings that we have to offer. So in recent years, we've widened the spectrum as to what qualifies as a gym reimbursement. Also, virtual classes qualifies as a gym reimbursement, and it's up to $300 for dual family or family plan. If it's a single plan, it's $150 check that you receive in the mail, and you can submit this directly from your Harvard Program Online account. These are the Living Well at Home classes that I was referring to at the beginning. If you'd like to enroll in any of these or sign up, simply go to harvardprogram.org/living well at home. And we want you all to know that we are here for you. Our member services is local in Quincy, Mass. The number is 888-333-4742. And we're also available to you on harvardprogram.org, and we're available 24/7. We also have a turnaround time through our member services. They email quickly within 24 hours as well. And I'm here. I'm happy to hear any questions you all have.
Thank you so much, Diana. We can open it up for a couple of questions at this point. You can either unmute to ask your question, or you can type it in the chat.
I do have a question, Diana. When seeking out a specialist, would you always need the referral from your primary care with the Harvard Pilgrim plans?
So that is a great question. So it depends. For behavioral health, so specialists in the behavioral health field, you do not need a referral. Also for women's health specialists, you do not need a referral, as well as for chiro or acupuncture.
Okay.
Mhm.
Right. Thank you.
And Diana, also, what about a fitness reward benefit? Did you mention that earlier on?
Yes.
Is
So
there a
the
fitness reward? I know that a lot of it is wellness and virtual, but is there also a reward? Okay.
Yes. So for dual or family plans, it's a maximum of $300. So each, either the subscriber or dependent child or the spouse can claim the reimbursement is $150 per individual. If it's an individual policy, the maximum is $150. But for dual or family plans is a maximum of $300.
Okay. And is there a form on your website that a person would submit, and how long do they have to be a member for
So they
to a
have to.
gym?
Yes, so submitting it online would through their Harvard Program Online account would be the best thing, just because it's the honor system. But we do also have a form, a paper form online that can be submitted via mail. It does take it a little bit longer to receive the check. We're finding that if you submit it directly from your Harvard Program Online account, it takes less than submitting the form. And you need to belong to a gym facility for at least 4 months and be a Harvard program for at least 4 months before you can submit for reimbursement.
Okay, fantastic. Thank you.
Also, the Peloton subscriptions do qualify as a gym reimbursement.
Great. Does anybody else have any questions? Again, you can unmute or chat. Okay, I guess we're going to wrap it up then. Thank you everyone for participating, to our employees, family members, and retirees. Thank you, Diana, for sharing all this wonderful information.
Thank you.
Again,
Liz.
this presentation has been recorded and will be available on our town website the next few days. And I encourage everybody to attend the upcoming trainings, as we'll be doing this throughout the day. This is open enrollment, so this is the time that you can make changes to your current coverages without needing a qualifying event. And we look forward to seeing you in the next sessions. Thank you, everyone. Have a great day.